Hey everyone, welcome back to Speak Healthy. Today, we are going to discuss the top 7 foods to avoid if you are suffering from arthritis and joint pain. Arthritis is a common condition that affects millions of people around the world. It is a group of disorders that cause inflammation and pain in the joints, making it difficult to move and perform daily activities. While there are many different types of arthritis, they all share one thing in common. The pain and discomfort they cause can be debilitating. While medication and physical therapy can help manage the symptoms of arthritis, diet also plays a crucial role in managing the condition. In this context, it is important to understand the foods that can worsen inflammation and joint pain and avoid them. In this video, we will discuss some of the worst foods for people with arthritis and joint pain, as well as some dietary recommendations that can help improve joint health. Number 1. Processed and fried foods. Processed and fried foods are popular choices due to their convenience and taste. However, they can be detrimental to our health, especially for people with arthritis and joint pain. These foods are typically high in saturated and trans fats, which are known to promote inflammation in the body. When consumed in excess, these fats can cause an increase in cytokines, which are proteins that trigger inflammation. This in turn can exacerbate joint pain and stiffness, making it difficult for individuals with arthritis to move and perform daily activities. Fast foods, fried snacks, packaged snacks, and processed meats are all examples of foods that are high in saturated and trans fats. Fast food restaurants often use partially hydrogenated oils, which are a source of trans fats in their frying processes. Fried snacks such as potato chips and packaged snacks like cookies and crackers are also often high in trans fats. Processed meats like sausage and bacon are another source of saturated fat that can promote inflammation in the body. It is important for people with arthritis and joint pain to limit or avoid these types of foods to manage their symptoms effectively. Instead, they should focus on consuming a diet rich in whole foods, including fruits, vegetables, lean protein, and healthy fats. Number 2. Sugary drinks and foods. Sugary drinks and foods like soda, candy, and pastries are not only bad for our overall health, but can also be particularly harmful for people with arthritis and joint pain. When consumed in large amounts, sugar can lead to an increase in inflammatory markers in the body, which can worsen joint pain and stiffness. Additionally, high sugar intake has been linked to an increased risk of developing rheumatoid arthritis, a chronic autoimmune disorder that causes joint pain, swelling, and stiffness. One of the reasons why sugar is so detrimental to people with arthritis is that it triggers the release of cytokines, which are pro-inflammatory proteins that can exacerbate inflammation and pain in the joints. Furthermore, sugary drinks and foods are typically high in calories and low in nutrients, which can lead to weight gain and increased pressure on the joints, further exacerbating arthritis symptoms. Reducing or eliminating sugary drinks and foods from the diet is essential for people with arthritis and joint pain. Instead, they should focus on consuming a diet rich in whole foods that are low in sugar, including fruits, vegetables, whole grains, lean protein, and healthy fats. This can help reduce inflammation and joint pain while also promoting overall health and well-being. Additionally, drinking plenty of water and low-sugar beverages like herbal tea and infused water can help keep the body hydrated and reduce inflammation in the joints. Number 3. Red meat. Red meat is a popular food choice for many people, but it can be problematic for those with arthritis, particularly gout. This is because red meat contains a high level of purine, which is a natural substance found in all types of meat, including beef, lamb, and pork. When purine is broken down in the body, it produces uric acid. High levels of uric acid can lead to gout attacks, which are characterized by severe joint pain and swelling. Gout is a type of arthritis that affects millions of people worldwide. It typically develops in men and women over the age of 40 and is more common in people who are overweight or have a family history of gout. In addition to red meat, other high purine foods that can trigger gout attacks include seafood, organ meats, and certain types of vegetables like asparagus and mushrooms. For people with arthritis, particularly gout, It is important to limit the consumption of red meat and other high purine foods to prevent flare-ups. Instead, they should focus on consuming lean protein sources like chicken, fish, and plant-based proteins like legumes and nuts. Additionally, they should ensure that they stay well hydrated and maintain a healthy weight, as both of these factors can help reduce the risk of gout attacks. Number 4. Dairy products. Dairy products are a common staple in many diets, as they are a rich source of calcium, protein, and other essential nutrients. However, for some people with arthritis, dairy products can trigger inflammation and joint pain. This is because dairy products contain proteins that can cause an immune response in some people, leading to inflammation in the joints. In particular, a protein called casein, which is found in milk and other dairy products, has been linked to inflammation and joint pain in some people with arthritis. Additionally, some people may be lactose intolerant, meaning that they are unable to digest lactose, a sugar found in milk and other dairy products. This can cause digestive discomfort and may also contribute to inflammation in the body. If you notice that dairy products worsen your arthritis symptoms, it is best to limit or avoid them. Alternative sources of calcium and protein include leafy green vegetables, fortified plant-based milks, nuts, and seeds. Additionally, now some people may find that consuming fermented dairy products like yogurt or kefir may be better tolerated, as the fermentation process can break down some of the problematic proteins. Number 5. Alcohol. Alcohol is a common beverage that many people enjoy, but for those with arthritis, it can be problematic. This is because alcohol can increase inflammation in the body, which can worsen joint pain and stiffness. Additionally, alcohol can interfere with some medications used to treat arthritis, making it more difficult to manage symptoms. Alcohol consumption can also increase the risk of developing certain types of arthritis, such as gout. This is because alcohol can increase uric acid levels in the body, which can lead to the formation of uric acid crystals in the joints. These crystals can cause severe pain and swelling and can eventually lead to joint damage. If you choose to drink alcohol, it is important to do so in moderation. The American College of Rheumatology recommends that women consume no more than 1 alcoholic drink per day, and men consume no more than 2 alcoholic drinks per day. It is also important to talk to a healthcare provider about any potential interactions between alcohol and arthritis medications. It is important to note that some types of alcohol beverages may be better tolerated than others. For example, red wine contains resveratrol, a compound with anti-inflammatory properties that may help reduce joint pain and inflammation in some people. Number 6. Processed grains. Processed grains such as white bread, pasta, and other refined carbohydrates are commonly consumed in many diets. However, for people with arthritis, these types of food can be problematic. This is because they are often high in refined carbohydrates, which can trigger inflammation in the body and worsen joint pain. Refined carbohydrates are processed in a way that removes much of their natural fiber and nutrients, leaving behind a product that is quickly absorbed by the body and can cause a rapid spike in blood sugar levels. This spike in blood sugar can lead to an inflammatory response in the body, which can contribute to joint pain and stiffness. Instead of consuming processed grains, it is best to opt for whole grains such as brown rice, quinoa, and whole grain bread. Whole grains are less processed and contain more fiber and nutrients than their refined counterparts. They are also digested more slowly by the body, which can help keep blood sugar levels stable and reduce inflammation in the body. In addition to whole grains, it is also important to consume a variety of fruits, vegetables, lean proteins, and healthy fats as part of a balanced diet for arthritis management. Number 7. Nightshade vegetables. Nightshade vegetables, including tomatoes, peppers, and eggplants, are a common part of many diets. However, for some people with arthritis, consuming these vegetables can worsen joint pain and inflammation. Nightshade vegetables contain a group of compounds called alkaloids, which some people believe can trigger inflammation in the body and contribute to joint pain. It is important to note that not everyone with arthritis will react to nightshade vegetables in the same way. Some people may find that they can consume these foods without any issues, while others may notice an increase in joint pain and stiffness after eating them. If you are unsure whether nightshade vegetables are causing your symptoms, it may be helpful to keep a food journal to track your diet and any changes in your arthritis symptoms. If you do find that nightshade vegetables worsen your joint pain, it is important to avoid or limit them in your diet. However, it is also important to make sure that you are still consuming a variety of other nutrient-dense foods to ensure optimal nutrition. Some alternative vegetables that you may want to consider including in your diet include leafy greens, cruciferous vegetables, and root vegetables. It is important to note that eliminating entire food groups from your diet without proper guidance from a healthcare provider or registered dietitian can lead to nutrient deficiencies and other health issues. It is always best to work with a healthcare provider or registered dietitian to develop a personalized nutrition plan that meets your individual needs and helps manage your arthritis symptoms.